So I want to talk a little bit about something that I find very distressing in the work that I do in hormones, and that is a condition called PCOS. It stands for polycystic ovarian syndrome. Why? Because it affects 25%, they estimate, of the premenopausal female population. So that's younger women, and of those 25%, only 25% of those have been diagnosed. So there's a lot of women running around out there with these symptoms. What does it look like? Excessive weight gain or having trouble managing weight, thinning scalp hair, excess hair on the face or the body, fertility issues, having trouble getting pregnant, conceiving. Acne is a big one. That you've suffered for some time is usually the criteria. Fatigue from poor sleep, mood swings, stress, a lot of stress and trouble kind of dealing with it, and some women have pelvic pain. And the funny thing is you don't have to have all these symptoms, just a few. Some people have a mix of those things. Not everybody looks the same on this, but there is a look of hyper or too much androgen or testosterone expression, and that's why the acne, it's why the thinning scalp hair, it's why we see excessive weight gain or a difference in the shape. A lot of times women with PCOS, they have a more straight male-like shape rather than a curvy, typical female shape. So these are all things that indicate you might have it. But one of the big ones is trouble conceiving or having irregular or very harsh periods from the start when you were young. So if you struggle with those things or you know anybody that does, it concerns me because this is probably the least understood condition that is the most common. And the great thing is it can be fixed. Something could be done about it, but you need to involve a practitioner that understands it, and they'll need to give you progesterone and manage the other side of it, which is insulin resistance. It gets a little complex, but those are the basic facts. PCOS, it's something that can be treated and is very common.